as we go through our session today, we might use different terminologies that some of us are not maybe so familiar with. So to ensure we are on the same page, I would like to suggest some definitions of basic gender concepts, because the understanding of this concept will help us be on the same page. And these concepts, in fact, they are guided by human rights standards and good practices at national, regional, and global level. But you may be familiar with other definitions of the same context, which is fine, as there are often different ways to define the same term based on particular culture or professional context, etc. So first of all, what is gender? What does it mean? We hear it a lot. Sometimes we have some understanding, and some other times we have another understanding. So basically, what does it mean? Gender refers to the characteristic of women, men, girls, and boys that are socially constructed. This includes norms, roles, behaviors which are associated with being a woman, a man, a boy, or a girl, as well as the relationship between each other and among themselves also, and the relative power they have or not as a result of these relationships. As a social construct, it varies across societies and over time, and gender is a relational concept that is best understood by examining interactions between individuals and social groups. So relationships and equal value associated to the fact of being a woman, a man, a girl, or a boy at different levels of life and different environments will expose different persons and group of persons to unequal opportunities. Within the family before she seeks healthcare, either for herself or for her children. But we know at the same time that in case of fever, in case of malaria, within 24 hours, over the decision to do that may delay the child's access to healthcare, thus reducing the chances to be hit appropriately. So you see, for example, between the lack of decision-making power of a woman and the health of a child or even herself when she's pregnant, for example. On another note, the fact that some women has a very limited mobility, especially in the first month of the pregnancy, because, for example, of gender norms or any other reasons, they may be missing out the appropriate doses of ITP, and they will be exposed to malaria. On another note, the fact that some women, let's stick to this example. Maybe another example would be around death-net distribution. When for example, some women or some groups of people are busy with their gender-related activities, they will miss out the opportunity to benefit from a bed nest. But in the same time, even when they benefit, even when the women benefit from bed nets, some of them may miss out the opportunity to use it. In fact, because they don't control decision around its use, doesn't guarantee that they are protected against mosquito bites. The husband might decide to use it as he's the possible breadwinner, or the wife can prefer to give it to the husband for the same reason, or the husband can even decide to use the bed nest for his own economical activities. We saw that in many communities, and it was not really business that are new, not necessarily those who are already used. So what does it mean, sex? Sex refers to a person's biological status, and it is typically categorized as male, female, or intersex. It is typically assigned at birth and refers to physical or biological indicators, including hormones, sex chromosomes, internal reproductive organs, or external genitalia, etc. Sex and gender are not the same at all. And like I was saying, gender is really shaped by social relationships. It changes over time and may be different in different societies. And sex is basically the same over societies, etc. And sex and gender are often uh, conflated, leading to the erroneous notion that gender norms and roles are biological determined and cannot be changed. For example, because a woman bears a child, gives birth to it, breastfeeds it, it becomes a common understanding that the major responsibility for upbringing the child and taking care of their health lies with the mother. And this will prevent men from understanding and playing, for example, their role in child upbringing and child care. In many cases, these misunderstanding can lead to gender-based violence against women and girls in many contexts. So, what is gender bias? It refers to the conscious or unconscious, explicit or implicit prejudice, actions or thoughts, or even inactions that could lead to unfair treatment of people based on their perceived gender. Gender bias in healthcare impacts various aspects of medical care, including diagnosis, treatment, research, and the interaction between healthcare professionals and patients. For example, in some settings, women who go alone to the health post to get their children vaccinated would be served after women who go to the health center with their husbands, because health agents would be perceived that the husband needs to go to work, so they need um wait on his wife quickly so that he can go to work. In many cases, that discourages some women from seeking health care. Let's look at now what is gender sex disaggregated data. That refers to quantitative and qualitative data collected and presented by sex that allows for measurement of social, economical, and social cultural differences between women and men. And for example, collection of data on the number of men and women of a given age bracket who access to malaria prevention in cares, in routine activities, or in mass activities. So sex disaggregated data is really important, as that will be the first input for a gender analysis. And when you don't do a gender analysis, you are not able to understand where the vulnerabilities are, where the inequities are, etc. So you understand that sex disaggregated data are really important, and they can also help us to develop gender indicators. Slide, please. Okay, let's look at intersectionality now. What does it mean concretely? In fact, as human beings, we all hold multiple identities, and these identities interact with each other, either to put us in a, sorry, in a in a privileged, I need to I needed to drink some water. So when these interact, they put us either in a privileged position or in a oppressed position. Sorry, I'm going through some health um, issues this morning. Sorry about that. So um, we really, these different identities put people in either a position of oppression or oppression. So the same person can be in a position of oppression or privilege at different moments of their life, or even at the same moment of their life, but in different context. This is called which is an important component of gender equity work because it acknowledges that the person's gender identity intersect with other identities, which needs to be taken into account, into consideration to better understand that a person's level of sorry, I can't hear the translators. Okay, thanks so much. So when we understand this question of intersectionalities, that will help us fix the level of vulnerability of the person and unique risks that person is facing, and that will help us better target our interventions. So gender equity, we are really striving for gender equity, which is about providing the resources that each group will need. So gender equity is about social justice. It means identifying existing barriers that some people or groups of people might face and provide specific action to address them so that these people or groups of people benefit from opportunities and realize their rights the same way as other people. So the reason is that women and men, boys and girls have different opportunities. They face different so I was saying that it means when we are bringing in equity dimension, it means that we identify existing barriers that some groups of people might face specifically, and those barriers are specific to their groups, and we provide specific actions to address these barriers so that these people or groups of people benefit from opportunities and realize their rights the same way as other people. The reason is that women and men, boys and girls, have different opportunities in life, and this starts at household level. And I was insisting on the fact that we really need to be careful about what are the dynamics at the household level. Most of the time, when we are addressing equity considerations, we look at what is going on at the community level, what is going on at the national level, etc. But we overlook what is going on at the household level. But this is a very, very, very important as well. Health Organization is saying, they said that health inequity refers to health inequalities that are unfair or unjust and modifiable. I would like to insist on that are modifiable. So, for example, across the world, people or groups of people who live in a remote area do not have access do not have the same access to malaria prevention and when they are in this is even exacerbated. Health equities is the absence of unfair systems and policies that cause health inequities. So we need to seek to reduce inequalities and to increase access to opportunities on conducive that we conduct to health for all. For example, during one of my field visits with a partner organization, someone was explaining to men that if they always put meeting very early in the morning, participation is very important to everybody to voice their concerns, participate participate in finding local solutions to community issues, etc. We when we approaching the programming, for example, everybody in the communities, all the segments of the communities, all this participation is really key in finding local solution that will benefit all, and we are sure we are not leaving anyone behind. So now let's look at gender equality. Gender equality is when you say gender equality, women that you are speaking about, that they are different, but this by different people and groups of people are identified and removed. So gender equity can be seen as the process, and gender equality as with the result, the destination, because when you are integrating a gender equity perspective, you will put into place affirmative actions, specific measures, etc. But the end result would be to get everybody to realize their right to health, or even their right to other things. However, even when you think you have achieved the gender equality, which is no country in the world has achieved it yet, even if you think you have achieved it, your job is not finished. You are not done yet. You need to put into place strong inequities and inequalities. Let's look at the gender norms now. What are they? Gender norms are perceptive attributes and characteristics of male and female gendered identities at a particular point in time for a specific society or community. They have a standards and expectation to which gender identity generally conform within a range that defines a particular society, a culture, and a community at a specific point in time. And gender norms are also about their ideas about how women, men, girls, and boys should be and act within their context. So these gender norms are really internalized, really gender norms can establish the life cycle of the socialization, stereotyping, discrimination, etc. Because when you don't conform to gender norm, you you go through punishment in the community. Slide. So there is an increase in gender equity. There is an increasing acknowledgement that gender equity can reduce the malaria burden across countries. We have a few examples linking lower malaria incidence and improved gender equity. In Uganda, for example, a program that increased the household agricultural income by engaging with female farmers led to an increase in bedding ownership and a reduction of malaria prevalence in these households. In Malawi, when women have an increase in household decision-making power, the likelihood of a family member in that household contracting malaria decreases. And finally, in a multi-country study, they found a strong negative connection between women's agricultural land ownership, and malaria prevalence. This also suggests that when women have greater economic empowerment and more say in decision making, we can see accelerated rates of malaria decline. Slide, please. Okay, thanks a lot. Now, I would like us to stop and hear from your own experiences, what in practice, how in practice you integrate gender in your activities. So, in your experience, how does gender affect access to malaria prevention and care? And how do you currently integrate sex and gender into your work? For example, does it happen that you think about different implications of or different challenges or different needs or even different coping mechanisms for malaria prevention and care faced differently by men and women, boys and girls? What were concrete actions you took and how did it make you work differently? Is gender a barrier to equal access to malaria prevention and care? Does malaria exacerbate gender inequities? How does it happen, etc.? So please feel free to come in with your own experience of integrating gender in your work. Over to you, please. And I guess Sorel will help us um, with the different hands. I cannot see the hands, sorry.
Oui, là, nous avons la main de Fadil qui est levée.
Okay.
Fadil, vous avez la parole. Allô, Fadil? Bon, si Fadil a des soucis de connexion, en attendant que Fadil nous revienne, nous pouvons passer la parole à Fontaine Mukanima. Allô? Allô?
Oui, allô?
Oui, Monsieur
Ouais,
Fontaine, vous avez la parole.
oui, merci pour la parole. Nous félicitons à la présentatrice pour cette brève présentation qui vient nous parler. Mais malheureusement, l'interprétation, le son n'était pas bon. Nous n'avons pas bien capté le débit. Comme elle a commencé, nous sommes le pays francophone. Elle a intervenu en anglais. C'est qu'elle a commencé au début, nous n'avons pas bien capté sa présentation au début. C'est ça un peu ma préoccupation. Merci.
Monsieur Fontaine, nous notons bien.
Vont faire face à des barrières différentes, etc. Les barrières auxquelles elles font face, les risques auxquels elles font face seront levés à un moment donné pour leur permettre d'accéder à leur droit à la santé. Et on a aussi dit, par exemple, voilà, on a donné des exemples autour de l'utilisation des moustiquaires. Parfois, certaines catégories de personnes, c'est pas forcément des femmes, certaines catégories de personnes peuvent ne pas accéder aux moustiquaires, aux espaces où on distribue les moustiquaires de masse, par exemple. Et ça peut être parce qu'elles sont dans des zones très reculées, ça peut être aussi parce que pour plusieurs raisons. Mais si les moustiquaires sont gratuits, parfois, il y a les coûts de transport. Il faut que ces personnes se transportent d'un endroit à un autre pour y accéder. Et le coût du transport peut être un problème. Donc, on a aussi parlé d'intersectionnalité. On a dit il ne faut pas seulement regarder les différences basées sur le sexe. Il faut aussi considérer le fait qu'une seule personne aura plusieurs identités et lorsque ces identités interagissent À un moment donné, ça peut renforcer sa position de privilège. À un autre moment, ça peut renforcer sa position de vulnérable, de personnes opprimées. Donc, il faut tenir compte des différentes identités au sein d'une même personne lorsqu'on essaie de voir sa vulnérabilité. Ça nous permettra de mieux cibler nos interventions parce que on sait que les ressources ne sont pas, les ressources sont limitées. Donc, parfois, il faut vraiment voir les plus vulnérables parmi les plus vulnérables. Donc, grosso modo, c'est ce qu'on a dit. Merci beaucoup. Thanks for your flexibility. Sorel, over to you.
Merci beaucoup. Merci, Madame Lehmann, pour tous les éclaircissements. Bon, je pense que ça a été davantage plus clair dans la tête de nos différents participants concernant le genre. Maintenant, nous sommes à la phase des questions où il est question ici de passer la parole aux participants en quelques minutes pour qu'ils partagent ou pour que chacun partage son expérience vécue dans le domaine du genre. Donc, là, nous pouvons d'abord passer la parole à Mohamed El Fattaou Hassan. Monsieur Mohamed, vous avez la parole. Allô?
Oui, bonjour tout le monde.
Bonjour, nous vous écoutons. Je propose qu'on prenne le maxi de questions et enfin deux réponses. Et je voudrais
Bonjour, est-ce que vous me
encourager,
recevez?
oui, je voudrais encourager tout le monde à mettre leurs réponses dans la chat.
Le financement du projet Momentum, du projet du financement de l'UICD à travers le projet Momentum Résilience. Donc, le thème était sur la qualité et la continuité des services SRBF dans les différents centres de santé. Et là, nous intervenons également dans le domaine de la lutte contre le paludisme, bien sûr. Donc, du coup, nos activités se sont un peu centrées sur l'organisation des ateliers villageois qui regroupent y compris les leaders religieux et les jeunes et les femmes en même temps, les groupements de femmes. Donc là, tout le monde est invité à donner son point de vue par rapport à un tel projet. Donc du coup, à travers cet atelier villageois, on arrive à recenser réellement ce que pensent les uns et les autres de la question du genre. Et là, d'autres n'ont réellement jamais entendu parler de la question, de la question du genre. Parce qu'aujourd'hui, quand on parle de la question du genre, ça ne concerne pas seulement les femmes, ça concerne toutes les couches sociales, y compris les hommes, les femmes, les jeunes filles et les jeunes garçons. Donc, du coup, à travers ça, beaucoup ont compris réellement c'est quoi le genre. Et là pour que les projets puissent réussir, sans plus monopoliser la parole, pour que les projets puissent réussir, il faut toujours mettre en relation donc la réalité du terrain. Et sans la réalité du terrain, franchement, nos projets ne peuvent pas réussir. Parce qu'aujourd'hui, je prends le cas du Cameroun. Le Cameroun, ils ont plusieurs saisons, peut-être une à deux saisons. Ici, au Niger, nous n'avons qu'une seule saison. Donc, du coup, si on essaie de dire que voilà, un projet dans le cadre de la lutte contre le paludisme va être financé, y compris le Cameroun, le Niger et peut-être le Burkina. Donc, du coup, il va falloir prendre en compte la réalité du terrain. C'est vraiment mon expérience
Effectivement, c'est ça.
je voulais un peu faire part aux uns aux autres. Je vous remercie. J'espère que je n'ai pas monopolisé la parole aussi. Merci.
D'accord, merci beaucoup. Merci, Monsieur Mohamed, pour toutes les interventions. Vraiment, bon, Maïmouna, moi, je proposerais que vous continuiez directement la présentation en 2, 3 minutes et ensuite on va passer à la phase de questions-réponses à la fin, vu le temps qui nous est imparti. Allô?
Okay, thanks a lot, Suran, and thanks also, Mohamed. It's really important to know the reality so that we contextualize our interventions. Slide, please. And please, everybody, feel free to write your answers and questions as well in the chat box. So I would like to present you this gender framework. Let's look at it as quickly, like Soren was saying. The gender equality continuum tool takes us from gender blinding to gender aware programs towards the goal of equality and better development outcomes. So awareness of the gender context, like Mr. Mohamed was saying a while ago, is often a result of the pre-program and policy analysis, gender analysis. So these tools can be used either as a planification phase or even like a tool to assess how you integrate gender. So you can use it at different phases of your program. Gender-aware context allow programs that to consciously address gender constraints and opportunities and plan their gender objectives. So the gender integration continuum is a tool for designers and implementers to use in planning and also gender in different programs. Like you see, if you take this tool, you will see, for example, where exactly you stand as far as your program is concerned. And if it is at the beginning of your program, you have the opportunity to see what exactly you need to be taking into account to intend that to say that you are integrating intentionally a gender lens. So, like you see, when it is the gender blind programming, the set of economic, political goals, etc., nothing is taken into consideration. And you even consider power dynamics between among men and women, boys and girls. You just come with global figures. You don't disaggregate anything, and you come for with a strategy fit for all. And as we were saying, we all know that because the risks, the needs, the barriers are not the same, the constraints are not the same, people will not have we will not have the same intervention for everybody. Otherwise, we will leave some of them behind. So gender awareness begins at the accommodating phase, you know. Even when you are in a gender exploitative phase, you will see that we have dots here, which means that it is not what we want to do that reinforces or take advantage of gender inequalities. Say, for example, that you know in the communities that men have a lot of power over women. So you just say, go see men, you discuss with them, and you ask them to make sure that women are coming to get their children vaccinated. You don't even mind how they will do that, even if they will exercise gender-based violence on them to get that made. You just use existing inequalities and stereotypes to achieve your program objective. You don't care about how things are done. So gender awareness will begin at the accommodating phase. And at that phase, you work around existing gender differences and inequalities. And that is where, for example, you can be applying equity measures. and gender transformative, where we are all where our ambition is to really be gender transformative. You will examine critically what is going on, where are the power imbalances, what can you do, counteract that, etc. And transformative gender programming includes policies and programs that seek to transform gender relations to promote equality and achieve objectives. So I will stop there for now. For the sake of time, I will stop there for now. And I'm curious to know, where do you see your intervention stand along this continuum? Over to you.
OK. Là, c'est la fin de la présentation par notre expert qui n'est pas là, comme vous l'avez constaté, comme on l'a dit, et comme vous l'avez vu dans les affiches, c'est un replay. Là, maintenant, nous ouvrons les discussions. Est-ce que vous avez des questions à poser? Est-ce qu'il y a des discussions que vous pensez que nous pouvons avoir? Nous sommes déjà désolés pour le temps. Nous savons que nous avons débordé de 7 minutes. Donnons-nous 2 minutes rapidement, juste pour parler un peu. Est-ce que cette formation, ce webinaire est important pour votre travail au quotidien? Donc, je vais laisser les uns et les autres réagir. Vous pouvez lever la main et dès que vous levez la main, on va ouvrir votre micro pour que vous puissiez réagir. Donc, 2 minutes rapidement. La parole est à qui veut la prendre? Comment vous avez trouvé la présentation? C'est vrai qu'on a eu quelques soucis de connexion. Maintenant, vous pouvez réagir.
Allô, vous m'entendez?
Oui, on vous écoute maintenant. Très bien, Christiane.
Ah, d'accord, merci. Bonjour à tout le monde et bon, je salue la présentation, même si j'ai eu des petits soucis à pouvoir capter les choses. Donc, ma préoccupation est vraiment celle-ci. C'est vrai que nous, on parle vraiment du genre et j'ai aussi vu qu'il y a eu des précisions concernant un peu tout l'aspect genre au niveau du paludisme. Mais là où je n'ai pas bien compris, c'est l'intervention de la collègue qui parlait aussi concernant les moustiquaires. Donc, je n'ai pas bien saisi. Je ne sais pas s'il peut y avoir une précision avec ça. Est-ce que dans ce qu'elle a dit, c'est pour dire que le genre se lie à la distribution des moustiquaires ou aux ménages qui n'ont pas reçu la moustiquaire, ou bien cette précision-là, je voudrais avoir parce que ça m'a perturbé un peu dans ce qui se disait tout à l'heure. Voilà un peu ma préoccupation. Merci.
OK, merci Christiane. Je crois que je peux apporter une réponse directement, bien que l'expert n'est pas là. Vous savez, généralement dans nos communautés, ce sont les femmes qui, dans certaines communautés, ce sont les femmes qui vont au champ, qui vont faire les travaux champêtres, qui vont puiser de l'eau. Et généralement, lors de la distribution des moustiquaires, je vais juste vous donner un exemple. On a eu un cas pareil, mais ce n'était pas les femmes, c'était une communauté, les Pygmées. Au moment où on passe pour distribuer les moustiquaires, ils sont au champ parce qu'ils vivent du champ, de la chasse et de la cueillette. Et donc, les femmes, parfois, au moment où on est en train de distribuer les moustiquaires, elles ne sont pas là pour récupérer les moustiquaires. Donc, il faut que les interventions dans la lutte contre le paludisme tiennent également compte de tous ces aspects-là, en fait. Donc, c'est pourquoi on disait, ça peut vraiment être impacté, en fait. Ça peut vraiment impacter, par exemple, une activité si on ne tient pas compte du fait que, par exemple, il y a des femmes qui sont impliquées, il y a des enfants qui sont impliqués, et on se dit non, on va aller, peut-être ce sont des hommes qui restent dans la cour du village. Et vous savez, parfois, tout ce qui a lieu un trait à la maison, à l'entretien de la maison et tout ça, les hommes ne sont pas souvent très impliqués. Donc, c'est la maman qui, sachant que son enfant aura le palu tout le temps, va courir pour récupérer, je dis juste un exemple, je donne juste un exemple, récupérer la moustiquaire, parce que c'est que quand l'enfant est malade, c'est elle qui est en mal. Donc, c'était juste pour interpeller et pour dire que voilà, on doit prendre en compte tout l'aspect genre, même dans la distribution des moustiquaires. Je ne sais pas si c'est bon, Christiane, si j'ai essayé d'élucider votre question.
Oui,
Euh,
oui, merci beaucoup pour la précision. Ça m'éclaire encore mieux. Donc, je comprends maintenant le lien avec le genre. Merci.
OK. Est-ce qu'il y a une autre question, euh, un commentaire? Oh, OK. S'il n'y a pas de questions, s'il n'y a plus de commentaires, nous vous remercions vraiment, vraiment, vraiment d'avoir pris votre temps pour écouter ce webinaire, ce replay. C'est vraiment notre reconnaissance en tant que secrétariat de CS Formi que nous sommes en train de vous exprimer. Restez connectés pour ce mois d'octobre. Également, nous aurons un autre webinaire et le mois de novembre et probablement également en décembre. Envoyez-nous vos questions, comme on l'a dit, nous allons les envoyer à l'expert qui va répondre et nous allons vous envoyer une liste de questions avec les réponses. Nous sommes reconnaissants pour toutes les personnes qui sont connectées de la Côte d'Ivoire en passant par le Sénégal, le Cameroun, le Ghana. Vraiment, merci, merci, merci. Restez connectés.